1440 KVON and 99.3 The Vine. This is Callie. Good morning. It is time for Health Bits, sponsored by Queen of the Valley Medical Center and brought to you by Senior Helpers Caring In-Home Companions. Robert Nations from Senior Helpers is here. Good morning.
Good morning, Kelly. How are things?
Oh, great. How are you?
I'm not too bad.
Good.
So I interned Steve. I mean, you're getting uptown here.
Oh, yeah. Oh, no, I always have an intern. Well, actually, we went a couple of months, about 3 months without an intern, but I usually have an intern here. But see, a lot of times they work behind the scenes, so you don't see them.
Oh, that's why I'm not seeing them.
But every once in a while, we get one that's real interested in engineering, so they want to be up here learning the board.
Gotcha.
Yeah.
Gotcha. Well, our topic today kind of threw me off when I learned about it because I thought I knew, generally being in, kind of the healthcare community, I thought I knew names, diabetes we all recognize, heart disease, those kinds of things. But when I heard this term, metabolic syndrome.
Yeah, I don't know what that is.
Does that ring any bells for you? It didn't for me.
I don't know what it is. I mean, I'm thinking it has something to do with like regulating your temperature. I don't know.
No. You're going to be surprised. You're going to be surprised then. So what I did was I went to one of our foremost experts in town.
Okay, great.
Dr. Rony Kako, who's with the Napa Valley Personalized Healthcare Practice, and asked him to come talk to us about it.
Oh, good.
I thought it was an interesting term. We need to learn about it. And so welcome, Dr. Kako.
Yeah, good morning.
Thank you.
I guess the first thing, what is metabolic syndrome?
So, most of us know about diabetes. We've heard about it. We've read about it. Metabolic syndrome is sort of the step before diabetes.
Oh, okay. So it's pre-diabetes? Would that be fair to say that?
That could be. That's one of the components.
Okay.
And it's really a group of abnormalities in your lab work and in your chemistries that increase your risk for diabetes, heart disease, high blood pressure, and so on.
So it's a combination of things, right? It's not just one thing. It's a combination of things like diabetes, a stroke, heart disease, all these combined.
Correct. So these risk factors actually will increase your risk then for diabetes, high blood pressure, stroke, heart attacks.
Oh, my gosh.
And it has nothing to do with temperature, but it's all the...
It was a guess.
That was a good guess. That was a good guess.
So tell me, who's at risk? I've never heard this term before. Now I'm getting to know it. But who's at risk for this kind of thing?
Let me actually start off by giving you just some statistics as far as how common this is. 1 in 5 Americans may have this condition.
Wow.
That's 20%.
That gets my attention.
20%.
Yeah.
And as we age, it becomes more common. So some studies are showing that maybe up to 40% in people in their 60s and 70s may have this condition.
Wow.
In terms of how bad is it, a person is 3 times as likely to have a heart attack or a stroke if they have this condition. And they're twice as likely to die from a heart attack when they have this condition. So it's serious, but it just doesn't get a lot of attention.
Right.
And the reason that I partially chose this topic is we'd like to intervene a little earlier with our patients, with American public in general. As far as risk factors, the American Heart Association has a criterion as who meets this definition. And if you have 3 or more of these following criteria, you have the metabolic syndrome.
Okay.
One of them is blood pressure. If your blood pressure is more than 130/85, which really doesn't sound all that high.
Yeah.
But it is one of the risk factors for this condition.
Now, is that the lower rate? Because, for years, when people thought you had hypertension, the rate was a little bit higher, but they lowered it a couple of years ago, correct? So is that the lower rate for hypertension?
That is correct. So as years go on, we're finding out that the lower the blood pressure, the less you have, obviously, as far as risk factors for heart attack and stroke. So when I remember the days when 140/90 was acceptable, now we're down to 130/80 or less because we're seeing a significant reduction in heart attacks and strokes when you lower the blood pressure number. Other risk factors, things that we don't even think about, waist circumference, how big your waist is. In a man, 40 inches, and in a woman, 35 inches. Anything above that puts you at risk for this metabolic syndrome. Cholesterol levels, HDL, which is the good cholesterol. In a man, if it's lower than 40, and in a woman, if it's lower than 50, that puts you at a risk. So obviously you want your good cholesterol up.
Okay.
So the HDL, that's the good cholesterol.
That's the, yeah.
You want that as high as possible.
Okay.
So if you have low numbers of good cholesterol, puts you again at a risk. And then sedentary lifestyle. We were just talking about that before the show started. We've all become sitting down, playing video games, working at the computer, and driving everywhere.
Right.
Sedentary lifestyle puts you at an increased risk. If you have a family history of diabetes, mother, father, brother, sister, who are type 2 diabetics, the type that usually doesn't require insulin, that also will put you at a risk. And finally, if your blood sugar is 100 or more, that's going back to that pre-diabetes we were talking about earlier. If your sugar is 100 or more, that puts you again at a risk for this metabolic syndrome.
And when you say 100 or more, you mean for a specific test, like where you don't eat?
Correct. So a fasting blood sugar, that's a good point. A fasting blood sugar of 100 or more, that says, you are at risk for this condition.
So that leads me to, how do you determine if you have this condition? And my gathering, you do a blood test. That's one of the ways to find out, right?
That is correct. So, having a panel of lab work, which includes the glucose, which is the blood sugar, and the cholesterol panel nowadays has in it the breakdown of the good cholesterol, the bad cholesterol, and triglycerides, which are drops of fat, if you will, that mostly come from eating a lot of starches and carbohydrates. You could do that blood test, and then your physician can sit down and go over the
and do your blood pressure and measure your waist. You could just, get a measuring tape.
Right. So I know in your practice, one of the things we've talked about is you get to do a lot of personalized kind of treatment. So talk to us a little bit about what you do with your patients to try and eliminate this or identify this and what you do with it.
Sure. With this practice that we have, we are able to do detailed physical examination. We call them the comprehensive wellness examination. You don't have to be sick to get this examination.
Oh, okay.
Because you remember, you can have all these risk factors of the metabolic syndrome and have no symptoms at all.
You feel fine.
You feel perfectly fine.
Yeah.
And so, we all know about blood pressure being the silent killer.
Right.
This is actually a killer as well, but it's very silent. And here you have 4 or 5 different things that are wrong that you don't even know that you have them. So you come into the office, we do the comprehensive examination, and we do a comprehensive panel of lab work that will include, obviously, the cholesterol and the breakdown of the good cholesterol, bad cholesterol, blood pressure, weight. We do the body mass index. That's another indicator of whether you're at risk for the metabolic syndrome or not. We sit down, we do a complete analysis of the labs, and we discuss with the patients, these are the abnormalities that we're worried about, and here's how we will address them.
So let's talk a little bit about prevention. Now we've talked about what causes it, how to identify it. What do we do to prevent getting to this point?
Absolutely. So much of what I do today ends up in the same common pathway of diet and exercise. Those are the two biggest things. Obviously, with a proper diet, a diet that's rich in vegetables and fruits, diet that is low on refined sugars. Everything now is labeled in terms of the glycemic index, how much sugar there is in a certain food. So diet becomes really the number one issue. Then obviously, really coupled with it, a co-number one, if you will, would be exercise.
Right.
People exercise once or twice a week and think, well, I'm exercising. That's not enough. All the authorities now are telling us 5 to 7 days a week.
Wow.
At least 30 minutes.
I'm just not going to do it.
Sorry. Don't say that.
I'm just not going to do it. But you can also count in that something like parking way far away at the grocery store and walking briskly in and out and going up and down the stairs of your house. I mean, can you do other things to work it into your life?
That's a very smart point. Absolutely. Patients often ask, do I need to go to the gym to do this thing? No, you don't. Exactly what you said. Incorporate into your daily life activities and events that would make you burn a few more calories and exercise some more. So absolutely, parking far, running up and down the stairs. But there needs to be a consistent effort.
Okay.
You can't park far away twice and then the next 5 times, and that's it. I've done it.
Drive 10 times in a circle looking for that close parking space.
Exactly. Christmas time, we've all done that, going to the mall. And so
I don't do that.
Well, we're in such a busy lifestyle. Our tendency is to park as close as possible so we can rush in and rush out. But I've learned that it's so much better for everybody to park as far away as possible. It's better on your car, better on your body, and walk.
Yep. Smoking is another one that I'm going to put a plug in. Do not smoke. I mean, that's another huge modifier as far as reducing your risk factor. If you stop smoking, it really makes things a lot healthier for yourself. Lowering your weight. How much weight should I lose? Most research says between 5 and 10% of your total body weight. If you can drop that, drop it slowly. Do it by modifying your eating habits and your lifestyle rather than these huge diets where you lose 30 pounds in 6 weeks and you gain it
all back.
Yeah.
And then
some. Usually you gain more back is my experience. So.
Right.
Correct. That's why they call them the yo-yo diets. I mean, you really
up and down. A little bit harder for apple-shaped women. I just got to put a plug in because I'm an apple shape. And when I gain weight, I gain it at my waist. That's about, my legs don't gain a lot of weight. The rest of me looks fairly thin, but then right around my middle is where I put the fat on. And then when you say, well, you have to watch your waist, I think that's not fair for apple-shaped women because it's so hard. And as I'm getting older, it's harder and harder to keep that off.
Absolutely. In fact, some of the research does use that exact terminology, apple-shaped weight gain, as one of the risk factors for this condition. And it has to do with insulin resistance and the body building fat around the midsection.
Right. I mean, that's hereditary, what shape you are. Some women have small waists and then they have a lot of junk in the trunk, And I always wish that was me. But no, I've got to have it around the middle. Even when I'm really thin, when I've been really, really thin, I'm almost straight up and down. There's like no in and out there.
Right.
So it's just not fair.
Thank Mom and Dad for that one.
It's just not fair.
It's a hereditary thing, right? Well, we've talked about this, but we didn't talk about you a little bit because I introduced you as an expert on this. But let's talk a little bit about your background. Sure. Let's talk about you've been practicing medicine in Napa for quite a long time?
Yes, I am. I started practice in Napa in 1993, and I had practiced in Sacramento for 2 years before that. I went to medical school at Medical College of Wisconsin and got to experience some nice cold weather being a California boy. I hail from Turlock, a small town in the Central Valley. And then when I came back from medical school, I trained in Stockton at San Joaquin General Hospital and thought I want to stay in the Valley, so I worked in Sacramento for a couple of years. But Sacramento was just getting huge at the time.
Yeah.
And I didn't feel at home in a large city. And I was fortunate enough to land a practice in Napa in 1993 and been here ever since.
And you've held some pretty prestigious spots at the hospital, if I'm not mistaken.
I'm active in the medical staff, and I had worked on several committees, and I eventually became a chairman of the Department of Medicine at Queen of the Valley Medical Center, amongst other committees that I've served on.
And I mentioned before you do a lot of personalized medicine now with this practice, because at the beginning of the year you changed your whole practice. Dr. G was here a couple of weeks ago.
You're right.
And you changed your practice from being all about the numbers to more personalized. Can you talk a little bit about that and why you're enjoying it? And
absolutely, I can take 3 hours of your time talking about the virtues of this. It's been a wonderful experience. We're able to spend a lot more time with our patients, a lot more detailed visits with them, longer visits. We're available to the patients 24 hours a day, and it's been a wonderful change. I think the patients are enjoying it, and definitely we are.
Well, that's great. I'm really excited about your practice because, I do a lot of seniors, and we have quite a few clients, patients, clients. I call them clients, you call them patients.
Right.
Thanks for coming this morning.
Yes, thank you, Dr.
Kako.
That's
metabolic
great.
syndrome. If you'd like to learn more about this condition or would like to contact Dr. Kako, you could access him through the queenofthevalley.org, which is their website, or by calling 1-877-QUEEN-LINE. And it's an easy way to get in touch with you. Just go right through the queen.org or through the Queen line. Coming back May 19th is our next program on Health Bits. And because we're getting closer to summer and all of us getting out in the sun, I thought it'd be appropriate to talk about skincare.
Oh,
I've already had my
great.
pre-interview. I'm very excited to come and talk with you and Dr. Davis about what we should be doing to protect ourselves against the sun. The sun's not bad. We should be getting our sun. Is that not correct?
Now, Dr. Davis is a dermatologist?
Yes.
He, she?
He, Dr. Robert Davis.
Oh, is he going to also speak a little bit about vitamin D? Can you ask him to
That's
add
what I'm
that
saying.
in?
The sun's not bad for you because you got to get that vitamin D in.
Like how to protect yourself from skin cancer,
Absolutely.
but then still get your vitamin D. That's going to be a great segment.
Yeah, I know.
I've been
looking
wanting
forward to
to
it.
do.
Yes.
Thank you so much.
Yeah, I'm looking forward to that.
Thank you, Robert.
So that's coming up May 19th.
Fantastic. Thank you. There's your Health Bits. And thank you, Dr. Kako, for being with us this morning.
Thank you.